Staying in contact. I'm London Mitchell. How healthy are we in Northwest Ohio? In Lucas County, the Healthy Lucas County Coalition has launched its Community Health Assessment Survey, described as a vital step in understanding and improving the health of residents. The coalition, facilitated by the Toledo-Lucas County Health Department, is a broad partnership of healthcare providers, government agencies, and community organizations working collaboratively to assess local health needs and drive meaningful improvements in health outcomes. And for this segment of our weekly chats, I have representatives from several of the coalition members. With me is Jennifer Archer, Director of Community Impact at University of Toledo Health, Beth Deakins, Executive Director of YMCA Healthy Living, and Brandon Polinsky of the Toledo-Lucas County Health Department. Hopefully, the survey will generate insights that can be turned into action through a community health improvement plan.
In the past assessments, we've seen an upward trend in things like obesity, diabetes, hypertension, or high blood pressure. We've seen an increase in the percentage of children experiencing allergies and asthma. We obviously don't know yet. That's what we're hoping to gather from this survey, is to see what the current issues are. But our last assessment from 2022 and 2023 is available on the Toledo-Lucas County Health Department's website.
How do people get involved in the survey, and what types of information are you really looking for?
That's a great question. People can get involved by going to our website. We are posting on social media this week to drive that engagement. The survey is primarily digital, so we do want people to try to go through that link. We are working with our partners throughout the community, our hospitals, our nonprofits, our government entities, to make it as accessible as possible for all of the constituents of our county. We do have it available in English, Spanish, and Arabic languages, so we can meet our community where they are, and they don't have to take a survey in another language about those important health topics.
And exactly what kinds of information are you looking for in the survey that's going to help you evaluate the data?
So the information we're looking for includes those health experiences that individuals have had, some of them going back to early childhood experiences, all the way up to, have you experienced this particular issue in the past year, in the past week? What are your habits right now? Do you eat certain foods? Do you partake in certain habits that may impact the long-term health in that community? And we're going to be looking at those issues from the lens of where in our community are the most prevalent areas to focus on. So do we see particular communities, particular zip codes, particular populations that maybe have different health needs, and how can we come together as a county to begin to address those?
My guests are Jennifer Archer from the University of Toledo, Beth Deakins from the YMCA, and Brandon Polinsky from the Toledo-Lucas County Health Department. Their organizations are partnering with others for a community health survey, and they want to reach out to all of us, even me.
I think we want you to fill out the survey, right? Like, that's part of this process. And coming from a hospital lens, right? So I'm at U Toledo Health. We work with our hospital and our clinics. And we know that when someone comes into the doctor's office for an appointment, we only hear a little bit of the story. We don't have the time to capture all of the information. My son's at a doctor's appointment right now. He only has that little tiny snippet of time to get in and talk to his doctor and explain what he's experiencing to try and get help. We want everyone in the community that has the time to take this survey to take it, like yourself, so we can understand a little bit more about your personal story, to figure out what are the things in your life that are impacting your health and the health of other people similar to you, that we can work on as organizations to really try and make a true change that is extending the quality of life for our residents in the community. Also extending out, you know, how old someone lives to be, right? Like we see different pockets in the community, and Brandon can speak better to this coming from the health department. There's different zip codes in our community where, you know, a block away when a zip code changes, the age of life that is expected is a dynamic shift. And it's really hard to understand that unless we can have some of those stories, like Brandon mentioned. It's not just about what you're doing now, but what have you done in the past? What is your, you know, what is your life included that could be impacting your health? Because without that kind of information, we only have the little tiny bit of the conversation that happens in a doctor's office, and it's really hard to change. So yes, we want you to take the survey so you can talk about what's in it and share that with other people, but we want you to take it because we want to hear your side of the story. Much like you're listening to ours today, there's value to what we walk away with. And, you know, I'm going to encourage everyone I walk and talk to that they fill out the survey. Brandon mentioned that we're, you know, getting it out to a lot of different places in a lot of different ways. Here at the university, we've got students that help people apply for Medicaid. All of the places they go to do that out in the community, those students are also going to be having the QR code available saying, please take the survey. Or if you need to know where you can go take it, the library has computers, right? We're trying to make it as easy as possible and encourage everyone, yourself included, to take the survey.
So I think that's a key point. You want everyone to take the survey. You're not looking at a particular age group or ethnic background or race. You want everybody.
Indeed, we want everyone that we can in Lucas County to take this survey. So if you live or work in Lucas County, your voice is important in helping to shape our priorities around health. So we want to hear from you.
If people aren't necessarily computer literate, is there a way to share their information with you?
Yes. So one of those ways is to reach out to any of the number of community organizations in the area that have the QR code posted. They all have access to paper copies of that survey as well. They could also contact the health department to get one of those paper surveys, and we'd be happy to collect that information from them that way. We know not everybody uses a computer, so we did make paper copies available. We'll also be out at lots of festivals and events happening now that the weather is getting nicer in Northwest Ohio. So if you see us at one of those events, there will be somebody that can help you complete the survey either online or via paper as well.
Based on what the survey has gleaned in the past, are there any big concerns for Lucas County? I mean, for example, do we have a lot of smokers, or are a lot of us tending to be obese?
Yeah. So we do see an upward trend in obesity and overweight in Lucas County. It's not a unique problem to Lucas County. As a nation, we're trending in that same direction. But we are looking at, as part of the survey, we'll ask things like, do you access the metro parks? What do you do when you're there, right? Are you walking the trails? Are you accessing bike lanes and sidewalks in your neighborhoods? Does your neighborhood feel safe to do those sorts of activities? I think the biggest issue we've seen in recent years has been a disparity, like Jen was highlighting, between different zip codes, different races and ethnicities. So just because we live and work in Lucas County doesn't mean we have the same health outcomes. So one of the high points of our current health improvement plan is working to address some of those disparities so that we can equalize the opportunity for health in Lucas County.
The Toledo Lucas County Health Department is obviously taking the lead in this, but when you start talking about what do you do in the metro parks, are you using bike lanes? We're talking about information that should be of value across the board throughout our government entities.
That's one of the beauties of our coalition. Healthy Lucas County isn't just the health department driving this. We are coming together with the YMCA, with U Toledo, with our other hospital partners and our nonprofits, because no one entity can drive that one whole health perspective. And we really are trying to bring all those things together to remind people that there are a lot of ways to reach your health, to improve your health. There is no one single thing that's going to impact everyone. And that's really what that coalition has been driving for more than 20 years. And every year we get a little bit better. We ask of questions that are more pertinent to our people. And that trend data just also helps us know, are we seeing new issues pop up? Are there ones getting better? Are there ones maybe trending a little downward? But that coalition has been just a wealth of community purpose and drive to improving the health of everyone.
The survey that you take online, I would assume, is pretty easy. People should not be intimidated.
Yes, very easy. And no questions are required. Aside from zip code, we want to make sure that we are getting responses from Lucas County. But other than zip code, you can answer any questions you want, leave the ones blank that you don't feel comfortable answering or don't feel are relevant to you. Obviously, the more information you provide, the better for us. But working within your comfort zone is certainly appropriate. And it's real simple, just clicking buttons.
I'm okay with telling people whether I exercise or not, but maybe I don't want to reveal my girth. That's okay.
Yeah.
You don't have to answer all the questions, right?
Indeed.
You can reach the survey online by going to lucascountyhealth.com/HLC. And again, they want feedback from as many residents of Lucas County as they can get across all age groups, neighborhoods, and cultures.
I think sometimes people don't understand the power of getting involved in different things, right? Like no matter what the subject is, no matter what the topic is, each person's voice really can make a critical difference. And in this, we're talking about, again, longevity, about quality of life, about the wellness and health of our children. And by just giving that little bit of insight about your experience and your story, you are able to make a real impact on what we can do in our community, how all of the health systems can help, how all of the different community organizations like food pantries and access to housing and all of the different things that fall into what we want to have be great in our community. Like just taking this 15 minutes to take the survey does matter. It does ensure, like Beth mentioned, we want to make sure people live in Lucas County that are filling it out, but we do want to make sure that we're hearing from the entire county. So taking the time, even though it seems like it's just another survey, it really does make a huge impact on how we can make our world locally just better for everybody.
You can reach the survey online by going to lucascountyhealth.com/HLC. And again, they want feedback from as many residents of Lucas County as they can get across all age groups, neighborhoods, and cultures. And that's our program for this week. I'm London Mitchell, inviting you to join me again next week as we continue staying in contact.